Good day. We are Level 4 Group 3A in completion for Module 5.2 Transcultural Perspective in Mental Health Nursing. We are tasked to present role plays of several clinical situations in which cultural misunderstandings occurred and will show how nurses in the situation will resolve this misunderstanding in a culturally congruent manner. So scenario 1, a 32-year-old Spanish female who just had a radical mastectomy removing both breasts is now awaiting for discharge instructions and health teachings by the nurse.
Good day, Mrs. Valdez. I am Janelle and I will be giving you discharge instructions. So can we start now?
Yes, we start now.
Okay, so let's start with your pain medication. So you can take it as needed, but make sure to note the interval for 4 hours from the last dose. And next, you have to ensure proper drainage of...
Very sorry, not understand you. Very sorry.
Oh, it's all right, Ms. Valdez. Do you want me to get an interpreter for you?
Yes, please. Yes, thank you.
Okay, let me get back to you in a minute. Oh, hello again, Mrs. Valdez. So this is Queenie, our interpreter. So shall we start again?
Buen día, señora Valdez. Soy Tini.
Hola, buenos días. Mi nombre es Ana Valdez.
Okay, so let's start with your pain medication. So again, you can take it as needed, but make sure to note the interval for 4 hours from the last dose. And next, you have to ensure proper drainage of accumulated fluid from your axilla. Third is you have to position yourself for first few days in 45 degrees position with your arms elevated.
Porque contigo yo ya escogí, ahora mi corazón te sufrí. Buen simpilang yo te pedí, era sintito el cosa yo ya sentí.
Hola, usted también, señora Queenie.
Also, ensure proper wound dressing, do passive exercises, and we also encourage you to have breast reconstruction to boost self-esteem.
Capiti milagro, viral tiempo, el mali hace derecho, da nam di mi lloreso, te pidió, era vida yo contigo.
Sí, gracias.
So that's it for today, Mrs. Valdez. Hope you have a good recovery at home, and thank you, Miss Queenie.
So in this scenario, it emphasizes on the most common barrier with regards to handling patients from the different parts of the world, which is the language. In the play, the patient came from Spain and only talked a little bit of English. Since there would be a miscommunication, the nurse decided to get an interpreter to properly deliver the discharge plan to the patient in order for them to properly understood one another and as well as the important instructions given. From their problem that was being encountered in the scenario was being solved. So scenario 2, a nurse observed bruises on client's body and thought that she was harassed, but turns out that the patient was practicing an alternative medicine.
Good day, ma'am. I am Junine. I will be your nurse for today. Ma'am, pwede ka mo talikod kay ato lang iasa si mong luyo?
Sige, ma'am. Sakit kayo. Dito di mawala. Pila na ni ka-weeks, oh. Uy, day. Kumusta naman ka? Naunsa man na imong luyo, oy.
Hala, ma'am. Naunsa man ka? Naay nagbunog ni mo? Gi-abuse ka, ma'am? Wala ni nahitabo, ma'am.
Halate, og nurse. Di mo na mauwi ni panghunda-hunda. Uy, nag-copy therapy ramang ko gahapon. Kay sakit kaayo, Jud. Akong likod, pila na ni kaadlaw. Unya, sige og kaping mga tulo sa usa ka week. Wala gihapon yung tangko na ayo ay.
Are you sure, ma'am? Wala na kay gitago or ba siniprotect ra ka sa ga-abuse nimo?
Ay nurse, tinuod jud na. Gahisgot man gyud to siya ato nga Niyaging adlaw nga mag-cupping therapy daw siya niya. O manggugog kasabot na ng therapy nga yung gihisgot. Uy mo nang nagsanong-sanong na lang sad ko.
So, the Asian countries, especially in China, cupping therapy is a form of alternative medicine in which a local suction is created on the skin with the application of heated cups. Oftentimes, it is misunderstood as being assaulted due to the aftermath of the heated cups being placed. So, scenario 3, a 22-year-old female Muslim patient has a follow-up checkup after having a minor surgery for head injury.
Good morning, ma'am. I am Jake, your nurse for today. How are you feeling?
Good morning. I feel okay.
How was your recovery and has your wound been healing well?
Yes, I think so. It was feeling a bit tender a few days ago, but now I think it's okay.
Okay, I'd like to begin by checking the location of your surgical wound to make sure that it has been healing correctly. May I ask you to remove your head covering?
No, I cannot remove my hijab.
I just want to check the wound. In order to do that, I need to take a look.
I'm very sorry, but I cannot remove my hijab in front of a man if it's not my husband. The doctor and nurse who took care of me before were all women. So if it's okay, I would appreciate if you have a female nurse. She can only be the one to examine this.
All right. I'll see what I can do. Hey, can you switch with me? I have this one patient who is giving me a lot of trouble. She says she demands a female nurse to take care of her. I'd asked her if I could examine her wound and she said no, and that she would never remove her hijab. How am I supposed to do this?
Can I see the patient's chart?
Here.
Okay, I see that the patient is a Middle Eastern Muslim.
Yes, and?
You have to understand that it is part of her culture. It is in her cultural and religious beliefs that they prefer a doctor or a nurse with the same sex as them to take care of them, and that women may only remove her hijab in front of other women or her husband. Even if we don't understand it, we must respect those beliefs when treating patients.
Okay, I understand.
What room is she in?
3B. And also, can I come with you? I'd like to apologize for the misunderstanding.
Of course.
Hello, ma'am. I have your nurse, Trisha, and she will be taking care of you. I would like to apologize for the incident earlier. I should have known better, and that was very ignorant of me.
No, it's okay. Thank you for understanding.
So, during hospitalization, Muslim patients' modesty and privacy should be respected. And ideally, they should be cared by a nurse of the same gender. So, this is particularly important in maternity or gynecological care. So, where gender-specific care is not possible, a male nurse caring for a female patient should always be joined by a female staff member or one of the patient's adult relatives. So, during clinical examination or procedures, Muslim men or women may be reluctant to expose their bodies. The health professional should request permission before uncovering any part of the body, and this should be limited to the minimum that is necessary. So that's all for our presentation. Thank you.